The term child will be used when describing skills that relate to both the infant, 0 to 1 year, and older children, 1 year to puberty. Support an infant's head with one hand whilst using a fingertip of the other hand to lift the chin into a neutral position. Support the child's head with one hand to gently tilt the head back whilst using 1 or 2 fingertips of the other hand to lift the chin into the sniffing the morning air position. Place the hands on either side of the child's head. 2 or 3 fingertips of both hands should be placed under the angles of the child's lower jaw. With the thumbs resting on the child's cheeks, lift the jaw upwards. Use an appropriate size, wide-bore rigid suction catheter under direct vision to carefully remove liquids such as blood, saliva or gastric contents. This airway is intended only for unconscious patients. Use an appropriate size airway. Estimate the size by selecting an airway with a length equal to the vertical distance between the child's incisors, or where they will be, and the angle of the jaw. Open the mouth. Suction if required. The airway can be inserted directly, sliding it carefully over the tongue, or it can be introduced upside down and rotated through 180 degrees, as for adults and older children. Whatever technique is used, do not use any force. If necessary, a laryngoscope blade or tongue depressor can be used to introduce the airway directly. Attach an appropriate size face mask to an adult or a paediatric self-inflating bag with reservoir system as appropriate, and connect to high flow oxygen 15 litres. This will achieve approximately 85 to 90% inspired oxygen concentration. It is recommended to use a viral filter between the bag and the mask. If single-handed, ensure a good seal of the mask by pressing down with the thumb and index finger of one hand, whilst lifting the jaw upwards with the other fingers and squeezing the bag with the other hand. Bag valve mask ventilation is better with 2 people. One person holds the face mask in place using both hands and a jaw thrust, and the other squeezes the bag. This should provide a better seal and more effective ventilation. Always remember to reassess after every intervention to make sure your airway management is effective. It is important to remember your personal protective equipment. Follow the current local and Resuscitation Council UK guidelines for current PPE requirements for resuscitation attempts.